following directly with your checkoff sheet, so make sure that you're following along as well. And we're gonna hit step by step exactly what's expected of you during your checkoff, okay? So you will notice when you look at your checkoff sheet that they are numbered by system or important group of information. You will see number 1, general survey, number 2, vital signs, number 3, HEENT, which stands for head, ears, eyes, neck, throat, so on and so forth. So they are numbered and it goes all the way up to 8. So when you're doing your checkoff as far as grading goes, you have to hit something in at least in every area of those 8 areas, okay? So if you miss a couple things in that area, you'll just get minus a point here and there. However, if you miss one entire area, if you only assess 7 of those areas and not the 8, you'll get an automatic second try. So it's important to make sure that you hit at least all 8 of them in some way, shape, or form, okay? So first thing we're gonna do, the second we walk into our patient's room, we are gonna survey the general area, okay? So we're gonna think of our ABCs. So airway, breathing, circulation. What does our patient look like? Is there safety things in place? Okay, if not, we're gonna fix that. Are there oxygen tubes? Is there IV tubing all over the floor? Is there oxygen hooked up? Is it at the appropriate leader? Is there any drainage in that suction back there? Is there a Foley catheter? Is it in the bed? Is it attached to the bed? So a general survey of the environment and of the patient as well. So we're gonna look for signs of distress in our patient. So is our patient blue? Is our patient labored breathing? Do they look disheveled? What's their overall behavior like? And we're just looking at an overall way. And then looking for their general appearance. Like I said, are they disheveled? Are they dressed for the weather? If you're in a clinic setting, are they coming in the middle of winter with short sleeve shirts? Are they clean and well groomed, or do they look like maybe they don't pay much attention to that kind of thing? Okay, that's your general survey. Next, your second task here is to do vital signs and height and weight, okay? So during your checkoff, we will have already checked off on vital signs, so you don't need to actually do the vital signs on your partner, but you do need to mention them. You need to say, I would check vital signs. I would check the blood pressure, the pulse, the respiratory rate. I would check the O2 sat, the temperature, the pain, and then I would also go get a height and weight. And we will do that after the fact, but we do have a height and weight machine as well, but you'll just verbalize that in your checkoff. Number 3 is your HEENT / your neurological exam. So when we're talking about this, we're gonna assess the orientation of our patient. So what that means is our patient cognitively aware of their surroundings, who they are, their situation, that kind of thing. So we're gonna do this by saying, all right, Mrs. Smith, can you tell me what's your name? And then they will say, oh, my name is Patricia Smith. And hopefully they answer that correctly. And if they don't, we'll make a note of that. And then we're gonna say, do you know what year it is? And then we're gonna ask them, do you know who's the current president? And then if they answer all of those questions correctly, we're gonna say that they're alert because they're awake and they're oriented to ×3 or to person, place, time, situation, that kind of thing, okay? So that's what we're gonna do to assess their neurological status. We're also gonna assess their speech. So is it clear when they speak back to us? Is it understandable, and is it appropriate to the situation, okay? We're also going to inspect and palpate the hair and the scalp. So we're gonna look up here at our patient. I'm just gonna check out your hair, see if I'm looking for, do I see any eggs or nits, any live lice bugs? Do I see any redness, any irritation? Does it look like maybe they've been scratching their head a lot? That kind of thing is what you're looking for in the head, the hair, and scalp, okay? Then we're gonna assess the ears. So we're gonna get our pen light and we're gonna assess the ear. We're gonna look at the external ear canal here, see if there's any lesions or skin issues here. We may look inside just to see if there's anything we can see. And then we're gonna do the whisper test as well. And this is going to tell us if our patient can hear correctly. So I'm gonna whisper a word. I'm gonna say, Mrs. Smith, I'm gonna whisper a word into your ear. Just repeat after me what I say. And I'll say, cat. And she'll say, oh, I heard cat. And then I'll do the same thing to her other ear, dog. And then they'll say, I heard dog. So that's the whisper test, okay? That's for the ears. When we're going to check the eyes, we want to think about documenting PERLA, okay? And that's P-E-R-R-L-A. And what that stands for is pupils are equal, which means they're the same size, okay? They are reactive, or they are round first. So are they round? The other R is for reactive. So when we shine a light in their eyes, does their pupil get smaller? Okay, that would mean that they're reactive. And then the L is for light, so they're reactive to light. And then the A is for accommodation. And so that just means when we take our pen light close to their nose, does their eyes cross to focus on that object, okay? And the way we're going to be able to document that is, first of all, our pupils, P and our R, and our P and our E and our R, we can get by just looking. All right, Mrs. Smith, I'm gonna look at your eyes. Okay, it looks like you have equal pupils that are round, okay? So we know we have our PER, okay? And then as we move on, our other R, reactive to light and accommodation. So we're gonna say, I'm gonna shine this light into your eye here and just check and see, okay, that reacted to light. I'm gonna check this one, okay, that reacted to light as well. And Mrs. Smith, I'm gonna check the accommodation on your eye. So just stare at this pen, please, as it gets closer to your face. And we'll expect to see their eyes cross to focus on that object, and that would tell us that they have appropriate accommodation. Now we can document that they have PERLA, okay? We're also going to check our cardinal fields of gaze. So you'll understand what this means when we go through cranial nerves in this class and we take our quiz about that, but your cardinal fields of gaze is just testing those extraocular eye movements. So we're gonna say, Mrs. Smith, I have my pen light here. I want you to follow it only with your eyes. Please don't move your head as I go into these motions. And we're gonna go almost in a star-like pattern. So we're gonna go up like this, back to the center, out to the side, back to the center, down, okay? Same thing on the other side, up to this side, and we expect her eyes to be following along without moving her head, okay? And that's gonna tell us that she has appropriate cardinal fields of gaze, okay? Then we're gonna check vision. We're gonna say, okay, Mrs. Smith, I have some letters on my pen light. Can you tell me what letters you see on this pen light? And she may say, okay, that pen light says ADC, or you can even use your badge. What do you see on this badge? And she'll say, oh, it says Team Ivy, or it says Stormy Hatfield, or whatever, to check her vision. You could use a Snellen chart as well, but for this checkoff, we're not gonna be using that. But in an appropriate clinical setting or clinic area, you would use a Snellen chart to actually test, do they have 20/20 vision, so on and so forth. Okay, so that's where we're gonna check vision. And then we're also going to say, another way to check vision for this would be to say, okay, Mrs. Smith, what color is my pen light? And she would say blue, and then we'd know that she can see a little bit, right? So that's all we're gonna be doing this check off, okay? And then we're gonna also look at her eyes. We're gonna look at the color of her conjunctiva and her sclera. So remember that her sclera is the whites of the eyes. So we're gonna be looking and just making sure that her eyes are white, that they're not yellow, she's not having jaundice, maybe that they're not bloodshot, or that you see like popped blood vessels or something else that may be abnormal. We're looking for white sclera, and we're looking for nice pink conjunctiva. So we'll say, Mrs. Smith, I'm just gonna look at your conjunctiva here. We pull her eyelids down, making sure that those areas down at the bottom of her eyes, that is pink, is pink like it's supposed to be. We're gonna make sure we're not seeing any drainage there. And we also want to make sure that it is pink, because a lot of times in patients that are anemic, or if they've lost a lot of blood, those will be white, and that's kind of a scary thing to see. So that's what we're looking at there. We're going to keep our pen light, and now we're going to look at her nose. We're going to look up her nose with our pen light. We're going to look at her nares and see if we see a deviated septum. We're going to look for any lesions. We're going to look for the color up there. Is there pink mucosa? Is there a foreign object lodged in there? And so that's how we're going to assess the nose. And then we're going to look at her lips and her mouth. And how we're going to do that, we're going to just look at the color of her lips just by visualizing, making sure that the circumforal area here around the mouth is not blue. That could be a sign of poor oxygenation. So we want to make sure that it's not blue. We want to make sure that we're looking inside the mouth and looking at those mucous membranes, making sure that there's no lesions, nothing in there, broken teeth. We want to make sure we make note of their hydration status. So are they dehydrated? Is their tongue like kind of furry looking? That could be a sign of dehydration. So we want to make sure we want their oral mucosa to be pink and moist. That's the goal. Okay, so that's how we're going to assess the lips and mouth. When we are assessing the neck, we're going to palpate the neck for swelling just by doing this. Seeing, is there any swelling here? I'm just looking for swelling, Mrs. Smith. And then we're going to palpate those cervical lymph nodes. So those are the lymph nodes in the neck. You should not feel them on a normal day. They feel like little beads when they are swollen, but in an ideal patient who doesn't have any issues and they're not swollen, you're not gonna feel anything. So you're feeling right here underneath the base of the neck here, up and down here to see if you feel any kind of nodules here, and downwards here, and you don't feel anything. That means Mrs. Smith is good to go, okay? And now we're finished with our HEENT. So now we're gonna move on to our respiratory assessment. So first thing that we're gonna do, we're gonna have our patient sit straight up so we can assess their back, okay? And we're gonna look at the skin over their back. We're gonna look at the color. We're gonna look at the texture on the back. We're going to make sure that there's no lesions. We're gonna make sure that it's the appropriate temperature. And we're gonna get our stethoscope out, okay? So at this time, we're gonna get our stethoscope out. We're looking at the back, we're assessing the back, and then we're gonna go into, Mrs. Smith, I'm gonna lean you forward so I can take a look at your back here. I don't see any lesions or anything. I'm just gonna take a listen to your lung sounds on your back. Every time you feel my stethoscope move, take a deep breath in and a deep breath out, okay? So I've prepared her for listening to lung sounds. I'll show you, I won't be able to show you right here how I do it on the back, but it's the same motions as if I do it on the front. So I'll show you the front motions here in just a moment. I'm gonna go ahead and listen to the back. It's important when you're listening to lung sounds that you are listening in a side to side. First this side, then down this side, then on this side, then down this side, and on this side. And I'll show you the pattern on the front here in a moment. The point of that is that we're always listening to one lung in one spot and then the other lung in the same spot, so we can compare bilaterally. If we hear crackles in this lung in this spot, but no crackles in this lung in this spot, then now we've compared bilaterally and we know that there may be a problem on this lung. Does that make sense? So that's kind of what we're looking at. So we're going to make sure that for your checkoff sheet says, we're gonna auscultate, which means listen, right, to posterior breath sounds on the appropriate side to side motion, like I told you, apex to base. So that means top to bottom. We're gonna listen in that fashion. And it also says a minimum of 10 places. There's a great graphic in your book. You should be able to find it under the modules. And it will show you exactly how you're supposed to do that. But I'm gonna go ahead and listen here, Mrs. Smith, to these 10 spots here. When you feel my stethoscope move, just take a deep breath. Okay, good. And it's appropriate to just listen to one inhale and one exhale with your stethoscope down each side. Okay, and we're gonna do that a minimum of 10 places there on her back, and then we're gonna just sit her on back here. Thank you very much, Mr. Smith. We're gonna move to the front now. Okay, so we're going to, obviously I would use a drape or something at this time to shield her her breasts if I needed to get access to that. You typically can listen to lung sounds over that, especially if it's a very thin gown. But the first thing we're gonna do, we're gonna assess the chest area, make sure that there's no lesions, no issues here. With that, we're looking for color, texture, temperature, and lesions. Anywhere that we're assessing the skin, that's what we're looking for, okay? And then we're gonna auscultate breath sounds here on the front, okay? Remember, apex to base fashion, a minimum of 10 places. And we're also gonna be able to assess for abnormal lung sounds or adventitious lung sounds is what we're listening for. So it should just be a very clear sound, that's what you should hear in essence on your stethoscope. If you hear an adventitious sound, you're gonna probably be able to recognize that something's not right, and it takes a little bit of practice to be able to hear exactly what that sound is and then name it. All right, Mrs. Smith, I'm gonna listen to your lung sounds again, okay? So take a deep breath for me. So here's my first spot. Here's spot number 2, and then we're gonna move down. Spot number 3, spot number 4, spot number 5, spot number 6, and as you kind of get down, it gets a little wider, okay? So you kind of go towards the outside to the side here. So then spot number 7, right under here, spot number 8, and then spot number 9 is down this way to the side here, almost laterally. And then spot number 10 is off to this side, almost laterally as well, okay? So that's your 10 spots for lung sounds, the same anterior and posterior, okay? Then you're done with the respiratory system. And then we move on to the cardiovascular system, okay? So it says on your checkoff sheet, you need to know where to auscultate heart sounds, okay? I'm gonna preface this by telling you that I'm recording this on my cell phone, and I have seen in the past students try to record their physical assessments and it mirrors the image. So when I tell you what side I'm listening to, I hope that this video did not flip it so that it looks confusing to you. When I say I am listening to the right side, I'm listening to the right side of the patient. When I'm listening to the left side, I'm listening to the left side of the patient, okay? Not of me, of the patient. And so hopefully this video doesn't flip it, but we're gonna go through this. This is another one, your heart sounds, that you have to have memorized, and you have to know exactly where they are for your checkoff sheet. You will find a great mnemonic and a way to memorize that under your modules, okay? So I'm gonna go ahead and when we're listening for heart sounds, we are really listening for the rate, which is the number, right? We're listening for the rhythm. So does it come like it's supposed to? Is it a regular rhythm? So that's regular or irregular. Does it come when you expect it to? Beat, 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 beat. Or does it come when you don't expect it? Beat, 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 beat. That would be irregular, okay? So your rhythm is always regular or irregular. And then your quality. So is it bounding? Is it kind of weak sounding? That kind of thing, okay? So those are what we're listening for. We want to make note of S1 and S2 sounds. We should hear both, and that's your lub-dub sound, right? We should hear both. And then we want to also assess for presence of extra sound. So do you hear anything extra, an S3, a murmur, a gallop, anything like that? Something that's just not right. So first thing we're gonna do is listen to these heart sounds. So your first spot to find is your aortic heart sound, okay? And that is on your right side, not your left side where your heart is, it's on your right side. And it's on that second intercostal space, okay? So it's right about here. And so you'd listen here for your aortic sound. So you just listen for a few beats, your aortic sound. And then next you're gonna move on to your pulmonic sound, which is in the same spot, just on the other side. So on the patient's left side. Okay, so your aortic is on the right, your pulmonic is on the left, and then as you get to the pulmonic, you're gonna move down to Erb's point, which is just down that next intercostal space, one down, so that third intercostal space, and then you're gonna move down again, excuse me, to your tricuspid, and that goes down just one more again, same spot right here, and that is at your fourth intercostal space. And then you're gonna move down to your final heart sound, which is your mitral or your apical heart rate, okay? Where you find your apical heart rate is typically, it's gonna be under the breast on this side, right about here is where you're listening. So right about underneath the breast on the left side over here, this is your mitral heart sound, otherwise known as your apical heart sound, okay? And apical heart sounds are very important. You will learn as you're studying. And that's in your fifth intercostal space over here to the left-hand side of the patient. So you do need to be able to identify where to locate these sounds. You need to know what you're looking for, which we've already talked about. You also need to know where all your pulse locations are, okay? The ones mentioned on your checkoff sheet include your temporal pulse, which is right here on both sides here, the one that you can feel pounding when you have a really bad headache. Your temporal pulse, your carotid pulse, which you can find on either side of the neck here. It's important to know that we're never gonna palpate both sides of a carotid pulse at the same time, because then you totally cut off blood supply to their head, okay? So one side at a time, but this is your carotid pulse here. The next one you need to know is your brachial pulse, and that's gonna be right about here, right? We're noticing our brachial pulse here in the bend of the arm, okay? Next one is going to be your radial artery pulse, okay? And that one's always on the thumb side, and that's the one we actually count pulse with. So that's our radial pulse, okay? Next is our femoral pulse, which is gonna be right here in between the legs here, or femoral artery, femoral pulse. The next one is gonna be your popliteal, which you can feel by getting your fingers back here behind the knee. And I encourage you can't see this very well, can you? So this popliteal right here behind the knee, like so. I usually take both my hands to feel it with one of my fingers back there. And I encourage you to practice on yourself, okay? Try to find yourself or your husband's or your wife's or your kids' pulses to know that you're looking in the right place, okay? Your posterior tibial is gonna be here on the inside of the back of the foot. And then your dorsalis pedis is right here on the top of the foot, okay? And if you need a better demonstration of these, because I can't bend this poor mannequin, here we go. Right here on this side of the foot here, right, kind of right about here. That's your dorsalis pedis or your pedal pulse. So you do need to know where to find all of those pulse locations during your checkoff, okay? And then you're done with the cardiovascular system. Then you're gonna move into the GI system, okay? Move this back together here. When we're talking about the GI system, we wanna make sure we're talking to the patient and reviewing their bowel movement pattern, okay? When was their last bowel movement? What did it look like? Is it their normal pattern, okay? We also want to look at their abdomen. We're gonna inspect the size of it. We're gonna inspect the shape. Okay, we're gonna expose you here, Mrs. Smith. I just need to look at your belly here. So we're gonna look at their abdomen, okay? We're gonna look at the size. We're gonna look at the shape. Is it symmetrical on both sides? What's the color? Is it pink in color? What's the texture? Is it smooth? Is it lotioned? What's the temperature? Is it warm? Is it cold? Okay, those general things. And then we're also gonna note any masses. That's what we're really looking for here. Are there any masses here? Okay, so remember, specifically with the abdomen, the GI system, we're always gonna look and listen before we touch, because any touching in the GI system can really mess up the normal pattern of things. It can give you bowel sounds when you really shouldn't have any, and all of that can really maneuver that type of thing. So we don't wanna really listen for bowel sounds before or after we touch and mess around here. So we always wanna touch last, okay? So next thing we're gonna do, we've already inspected or looked at the abdomen. Now we're gonna auscultate or listen to the bowel sounds, okay? So bowel sounds, clicks and gurgles is what we're looking for, should be heard every 5 to 15 seconds in all 4 quadrants. So the abdomen is divided into 4 quadrants here, as an imaginary line right here down the middle, and then into 4 quadrants here right down the middle of that, okay? We always wanna listen to bowel sounds in this order: right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And the reason for that is because that follows the normal pattern of the stool that the stool follows into the bowel, okay? So that's a good way to locate a blockage if one were to be there, okay? So we're going to listen. We're wanting to hear those bowel sounds in all 4 quadrants here. Ms. Smith, I'm just gonna listen to your bowel sounds here, okay? You can breathe normal. Just gonna listen here for a couple minutes. Good. And then I typically, once I'm confident that I've heard enough bowel sounds, I move along. You don't really have to be here for very long as you're confident that you hear those things. Very good. Your bowel sounds are audible and active in all 4 quadrants, Mrs. Smith, so that's really great. And then lastly, we're going to palpate, okay? We're going to touch all 4 quadrants. We're gonna look for masses. We're gonna look for tenderness. We're gonna look for guarding. Do they act like they're in pain, so they're holding and they don't want you to touch? That kind of thing. These are things that we're looking for. So our patient would actually be laid down at this time. I don't know if you guys are gonna have a great view if I lay her down, but I'm going to try. I'm just gonna lay you back, Mrs. Smith, okay? I'm gonna rub on your belly here. You let me know if there's anything that you think is abnormal as far as pain, or if there's a spot that's super tender, okay? And so then you just gently palpate. You would push down a little bit, palpating, seeing if you feel anything that is abnormal. Everything feels fine. And then the last step on your GI system assessment is to assess for rebound tenderness at McBurney's point. So McBurney's point is right down here towards the right lower quadrant. And what that is, that's a place that's going to show you pretty much it's an indicator of appendicitis. And what you're looking for is rebound tenderness. So you would say, Mrs. Smith, I'm going to push down really hard on your belly. Will you let me know if you feel extreme pain when I let go? So we push down on there, and then the patient would feel no pain if they had a positive sign at McBurney's point. If they were showing they may have appendicitis, they would feel no pain as I push, but as we let go, they would feel rebound tenderness. They would have abdominal pain down there in that area. And so that's what we're assessing for. And then we would keep them in a laid down position, because now we're gonna move on to the urinary system. And when we're talking about the urinary system, we wanna talk to the patient about their voiding pattern. So Mrs. Smith, how have you been peeing lately? What's the color? Does it burn when you pee? Do you feel like you're going more than usual? Those kind of questions. And we want to know, does your urine have any specific odor? Does it smell okay? You know, that kind of thing. And then we're gonna palpate the bladder for distension. So again, I'm just gonna rub your belly here real quick. We're looking right about here for bladder. You'll be able to feel it, kind of feels like a little water balloon in there if you're feeling distension of the bladder, okay? And that's really all there is to assessing the urinary system. We're gonna go ahead and set you back up, Mrs. Smith, okay? And then we're moving on to the musculoskeletal system. This is your last system here that you need to address. We're gonna look at her upper extremities, okay? We're gonna look at her arms here, both arms. Make sure you do both arms in your check off, okay? We're gonna look for the color. We're gonna assess the texture, the temperature, the presence of any lesions that we see, and we wanna assess skin turgor, okay? So skin turgor is typically best assessed here on the top of the hand, or sometimes even on elderly patients here on the chest. But what skin turgor is it tells you how hydrated your patient is, okay? It's gonna be hard to check on Mrs. Smith, but it's easy to check on ourselves. So if you see your hand here and you just pinch, you see how my hand, I can pinch this. If I were dehydrated, my hand's skin right here would continue to stay tinted when I let go. But I can see that when I let go, it bounces back to its normal position. So I have good skin turgor, right? And if it was tenting, which means it stayed there in that pinched area, that would mean that I did not have good skin turgor and that I would be dehydrated, okay? So that's what we're gonna do on these upper extremities. Test for skin turgor. Also assessing capillary refill. So again, it's gonna be hard to test on Mrs. Smith, but you would just take a finger, compress over the nail bed so you can look at the nail bed. Now you have to make sure that they're not wearing any nail polish, otherwise you wouldn't be able to see, but we're looking over the nail bed, pinching to blanch it to see if it turns white, and then see how long it takes to for the pink in color to come back, okay? We're looking for less than 3 seconds for capillary refill. So you can test it on yourself or on your people at home, and that's kind of just a thing that you'll have to get used to as far as that goes. But that's how we're going to assess the upper extremities. Another thing that we're gonna do while we're here after capillary refill, we're going to do range of motion. So we're gonna either tell Mrs. Smith to move herself if she can, or we can move it for her if it's passive range of motion. And then while we're doing that, we're gonna observe for joint swelling and tenderness. We can ask Mrs. Smith, do you have any tenderness or pain in any of your joints? Then we're gonna do grip strength. So we're gonna hold Mrs. Smith's hands on both sides, and we're gonna say, okay, Mrs. Smith, squeeze my hand as hard as you can. And then we're gonna assess grip strength, okay? This can be documented in like a +1, +2 type format, which you can read about in your book, okay? So we'll do grip strength. And then we're gonna assess for edema. So we know that edema means swelling. I don't see any edema on Mrs. Smith, so we're gonna move on from that. So that's great. And now we're done with upper extremities. And then we're gonna move on to lower extremities, okay? Mrs. Smith, I'm gonna remove your blankets here. I'm gonna look at your legs. And so as we're looking at Mrs. Smith's legs, we're gonna do pretty much the same stuff that we did with Mrs. Smith's arms. So first thing, we're gonna assess the color, we're gonna assess the temperature, the texture, and the presence of any lesions, okay? We're looking at both legs here, both feet. We're gonna assess the skin turgor. You can do that on the top of the foot, see if her skin tense or not, and then we can check her capillary refill. So we'll do that over the toes. Again, make sure we're not wearing polish at this point, right? After capillary refill, we're gonna do range of motion. She can either do it herself or we can do it for her. And then after that, we're going to assess for leg strength. So we're gonna do that by asking her to move her leg against counter pressure. So we're gonna push her foot back and we're gonna say, Mrs. Smith, push me away. When I put pressure on your foot here, push me away. And she'll do this to try to get us to move. And you assess how well or poorly they were able to do that. And then lastly, for the lower extremities is we are going to assess for edema. Now, bilateral lower extremities is where you're gonna mostly see edema, especially in heart failure patients. And as it gets bad, it travels up the body. However, you do often see it dependently here in these lower extremities first. So we're gonna look and see, is her leg swollen? And if so, is it pitting? And so you can see there's lots of nice charts in your book that tell you about pitting edema. And so you need to know, are they pitting? And if so, how much? So as you push in, is it a +1 edema? Is it +2 pitting edema? Is it +3? Is it +4? These are things that you can find out from the table in your book that will tell you how it's all dependent upon how far in your finger goes, and then when you take your finger off, how long that imprint stays there, okay? So we're assessing for edema. At the end of this, we're gonna ask our patient to stand. Obviously, I can't get Mrs. Smith out of bed, and you guys are gonna be doing this on each other, so you're not gonna have that problem. But as we're asking our patient to stand, we're gonna have our patient stand up, and we're going to have them bend over like so, and somebody's going to look at their spine. Do they have any spinal deformities? Do they have scoliosis, anything like that? And then it's also a step on your checkoff sheet to observe the patient's buttocks, note the presence or absence of pressure areas on the coccyx. Obviously, you can just verbalize through that during your checkoff, but it's a very important step, especially in the admission process as you are assessing your patient, okay? And then lastly, in that musculoskeletal section is to assess the ambulation and the quality of their gait. So you would say, all right, Mrs. Smith, please walk all the way to the wall, maybe all the way to the wall on your heels, and then come back on your toes, and then just walk normal. What's the assessment? Did they walk normally? Did they look like unsteady on their feet? That kind of thing. And then your last couple steps, you're gonna do your final steps, and then you're going to document the entire physical assessment findings. You're gonna document vital signs, and then you're gonna document the patient's response to the procedure, okay?